I was in between the runway to pick up a patient from air ambulance. I went to a missile manufacturing company where I got to present BLS and CPR. I went to an international football match where India and Syria have played as a part of emergency medical support. I got to meet few Tollywood celebrities. I went to Mangalore where I presented a poster in a medical conference. All in all, this year has been very interesting. This video is all about it. It's story time. Let's get cinematic. 1 year, 365 days. In the world where it never slows down. In a world where every second counts. Emergency medicine. Let's start from the beginning why I chose emergency medicine. I was always inclined towards medical branches, but I did not want to restrict myself to pen and paper. I wanted to do procedures, but I definitely did not want to get into surgical branches. Then I found a sweet spot, emergency medicine, where you get to see medical emergencies of various specialities and do various procedures. Moreover, I always liked the instant gratification that you get when you resuscitate or revive a patient. When you intervene and see the patient getting better in front of your eyes rather than treating a chronic illness on OPD basis. I came into this residency with passion, but nothing truly prepares you for the chaos and a rush of emergency department. The pressure, the unpredictability, anything can happen at an instance. Initially, it felt like a storm, rushing from one patient to other, trying to keep ahead, trying to make a difference. You'll have several questions. You will doubt yourself. Am I enough? Am I doing enough? At that point, your workplace and your seniors matters a lot. I come from a government hospital where there was no emergency department. Cut to 2023, I am in one of the most prestigious and international recognized hospital with one of the biggest emergency department in the country, with almost 16 to 18 consultants who have finished their MD, DNB, or even both. Our HOD is a super specialist in the field of critical care medicine. Since we have the concept of ED ICU in our hospital, we get to learn few ICU concepts as well. There are several specialities and departments in our institute. So when their patients visit emergency department, we get the exposure of their concepts as well. For example, electrophysiology of cardiology. We have that department. So many patients with arrhythmias like atrial fibrillations, supraventricular tachycardias visit our department very often. Not only for emergencies, but for some elective procedures like cardioversions also. Since we have the department of interventional radiology in our institute, we have an option of mechanical thrombectomy for the patients presenting with stroke to our department. Our hospital is known for its gastroenterology department, so we see many GI emergencies every day. But apart from this exposure to several cases, apart from the people I get to learn from, the thing I like the most about my department is the amount of mutual respect everyone has. Not just between consultants and residents, between seniors and juniors, and between doctors of various departments. The next thing that I like the most is academics. Our hospital conducts grand rounds every month. In that, heads of different departments present very interesting clinical cases, and every senior most doctor in the hospital attend that session and give their valuable inputs. Academics in our department include rounds with our HOD, bedside teaching by consultants, our presentations, and discussions with other specialities. Coming to my seniors, they have been nothing but supportive since the day one. They have taught me many clinical concepts and trained me in several procedures. And when things got busy and when things got difficult, they always came forward to help us a lot. There are few things that you need to learn during your first year. For example, triaging. Triaging is nothing but assessing the patient's symptoms, examining him, anticipating the complications, and then assigning a priority. Regarding the examination, you learn your clinical examination skills from your MBBS days, internship. Adding on to that, you learn few more things like primary assessment, secondary assessment, adjuncts to the primary survey, and systemic examination. You need to learn few soft skills as well, like communicating with the patient, counseling the attenders regarding the prognosis, discussing the patient condition with other specialties whose inputs are required, debriefing the patient condition when you're transferring that patient to the concerned department. Once you get to learn these things, the chaos becomes clarity, the rush becomes rhythm, and the pressure gets little easier. Every day you get to learn something new, not just about medical concepts, but about yourself. In this first year, I got to see many exciting things being performed, many meticulous procedures being done at the very bedside in emergency, like endoscopies being performed by gastroenterologist, an EVD, drain in brain, put by a neurosurgeon, bedside cardioversions done by electrophysiologist through the implanted device, bedside 2D echoes, bedside dialysis, plex, and so many things. There are many procedures that I got to do myself, like placing central lines, arterial lines, intubations, cardioversions, putting an ICD, doing ascitic tap and pleural tap, so on. Apart from the things that I've done in the hospital, there are several exciting things I got to do outside the hospital as well. For an instance, I went to an airport onto the runway to receive a patient from air ambulance. In other instance, I went to an international football match, India versus Mauritius, as a part of emergency medical support. I got to meet few Tollywood celebrities who came to our hospital. Our hospital conducts campaigns to raise awareness about life-saving skills like CPR. As a part of that campaign, I got to present BLS class in various institutes like a missile manufacturing company, in a police station where the newly recruits are being trained, in many software companies, and in one of the most elite gym of Hyderabad. I got a chance to present a poster in a medical conference conducted by Kasturba Medical College based on the theme of disaster medicine in Mangalore. 1 year. It feels like a lifetime, but this is just a beginning. To conclude this video, I would like to give few suggestions to my juniors. Always be open-minded. Try to learn something new every day. Don't shy away from taking help. Thank you and sorry are very powerful words. Don't hesitate to use them. Don't ever lie if asked about patient details or vitals. If not examined, examine and then answer back. I know it will be difficult, but try to have some fun.